Maybe you have heard of the Crying Stone or Kakamega Forest, or maybe you have heard of Oparanya Care or just Oparanya. Then you must have heard something about Kakamega County. Under the leadership of His Excellency Governor Wycliffe Ambetsa Oparanya, Kakamega County government has excelled in many areas. One area that defines this excellence is health.
Over 30% of our entire budget, which is a third, more than a third, goes to healthcare, both recurrent and development actually goes to healthcare. And as a county, we have come up with quite a number of programs. The most important program that we came up with is this Linda Mama na Mtoto program, where we have encouraged mothers to come, when they become pregnant, they come to clinics, they are checked throughout the period until delivery, and then we encourage them to deliver in hospitals, food facilities. Before this was, they were to go to any health center and deliver, but now with other development partners coming in, we are trying to improve the maternity wards in level 4, so that any delivery, there must be a full-fledged doctor present to ensure that the delivery is actually safe. And we spend about 100 million shillings on this program. This is a very popular program that we have now over 40,000 mothers on this program. We have also improved the terms of the human resource in the health sector. We have employed more doctors, we have employed more nurses. If you looked at the number now, it's double, more than double what we found when devolution was established in 2013. We have improved all our level 4 hospitals. We have 14 of them. If you visited them, you'll find that we have improved in terms of wards, in terms of outlook of the entire facilities. But however, we have also constructed 2 level 4 hospitals. One in Mumias, and this one of Mumias, we just opened the doors this year, and in fact it became the COVID center. And there is one just not far from where we are. It's called Shamahubu in Shinyalu constituency. Shamahubu in Shinyalu constituency. It's also a very, very modern facility that we are going to have it open the doors this particular year.
We have also had improvements in the services we are offering to the residents of Kakamega County and even the neighboring counties. We have, including what? Specialized treatments we are offering specifically at Kakamega Level 5 Hospital, CGH. That is renal. We have oncology, which deals with the cancer, the eye clinic, and then we also have the ICU. Other departments like radiology is also fully functional. The laboratory, also very modern and fully also functional, including new machines that can only be found either in Jaramogi Oginga Odinga or Moi Teaching Referral. So in the rest of this region, you wouldn't find such a machine. For example, like the Cobas machine, which can undertake tests of more than 400 diseases, and then the histology. We can now even test cancer locally here in Kakamega.
This county boasts of one of the largest and most equipped referral hospitals this country will have upon completion. Kakamega County Teaching and Referral Hospital. This is just one of the many ambitious dreams that County Governor Wycliffe Oparanya had when he came into office. And this dream, like many others, is turning into reality.
This is a very modern referral, and it is going to be strictly referral. we want to specialize in 3 or 4 specialized areas. Like we find that our people here have a problem with cancer. We have also established for the same for diabetic patients. So we want those 2 to be our specialized area for this particular hospital. It will be just a specific referral hospital. So it will not be a walk-in, walk-out, no. If level 5 will still remain as a walk-in, you can walk in and be attended. But this one is going to be a very specialized hospital. We intend that hospital to be supported by a doctor's plaza, where specialized doctors in the region will come there, specified days, to look at their patient. We have also discussed with other private hospitals in India, and they are ready to send their doctors here on specified days and so on, so that they can also look at our patients. And this will cut down on the cost of our people traveling out there to be treated in terms of transport and so on. We are hopeful that with the money, God willing, this facility will be opened this year officially. That is the phase 1 of this hospital. We have phase 2 and phase 3. The cost of that hospital at the moment, without equipment, is going to cost us about 6.2 billion Kenya shillings. That is without equipment. And we are expecting equipment to be about 2.5 billion. So overall, we expect to spend about roughly, for it to be operational, have human resource, training of those human resource, 10 billion. This is entirely from our county funds.
In an effort to take healthcare closer to the people, as is intended by devolution, the county government has built new hospitals while upgrading existing facilities to better standards within the sub-counties. In Mumias West Sub-County, for example, the county government has built from scratch Mumias Level 4 Hospital that is serving residents in the area and beyond, reducing their expenses in terms of ease of access, thus improving their quality of life.
Walituletea hospitali level 4 hapa Mumias. Imeanza juzi vile kumekuwa na shida ya corona, wakaifanya ikue, wameweka wodi za watu, kuweka watu wa corona. Nafikiria hiyo janga ikiisha, itakuwa inatusaidia sisi watu wa Mumias, kwa sababu tuliendanga Kakamega General, tunaenda Matungu, tunaenda Kisumu, tunaenda referral. Lakini sasa tumepata hospitali, sasa tutakuwa na shida, tutakuwa tunatibiwa hapo.
Narudishia mkubwa gavana wetu shukrani kubwa kwa kutuletea hapa level 4 hapa Mumias. Tunajivunia. Tena hata kuna wale wanaajiriwa upande wa usafi tuko nao kando na sisi wa kaunti.
Upande wa vyakula na vitu vingine tunakula vizuri sana. Chai asubuhi, uji in the morning kama saa 1, saa 7 tunapata lunch, jioni kabla tujaenda nyumbani. Wenye hawaishi namba 70 tunakunywa chai kabla hatujaenda nyumbani, na tumefurahia. Tunaomba Mungu aendelee kumpa nguvu, aendelee kutimiza. Hata watu hapa wanapofurahia, wamefurahia kwa sababu for the first time Mumias ipate hospitali mzuri kama hii.
In Kakamega town, which is the county's headquarters, His Excellency Governor Oparanya will soon be launching a state-of-the-art funeral parlor that will cater for the needs of all in society, with high-income and low-income earners. It is the first of its kind in the Western region. The funeral parlor is also one of the few in the country headed by a pathologist.
We had an old mortuary, which probably was constructed in 1973, with a body capacity of 32. But weight then will have between 65 and 75 bodies at any time, which was more than double its capacity. 2, it was not well maintained.
We have separated areas of the police, police being a public institution. Police bring their bodies there some of the bodies in a very bad state. We have separated that. But even now, as the police come with them now, we have also now proper treatment process so that the smell we used to have is no longer there. We have also now had our own section for those who die within our facilities, like the hospital, our level 4, level 5 hospital, or any facility of the county government. They have now also a section. We have also created a section for the VIPs.
To be able to accommodate more than 110 bodies at any given time.
Kuna mwili ya relative yangu nimekuja kuchukua because he had passed on. So according to venye hii mochari iko ni venye inashughulikiwa, madokta wanashughulika faster, iko more secure compared to other mortuaries. Then ni kusafi, si kama hizi zingine venye huwa inatoa ile harufu.
Not far away from the beautiful Pala lies Kakamega County Referral Hospital Level 5, which has been uplifted through equipping and renovation.
We have spent over 400 million Kenya shillings to just carry out renovation. It had asbestos roof. We have removed that and put proper corrugated iron sheets. We have equipped. We have now one of the modern equipments, X-rays and all that is properly done. We have now even created a place for civil servants. So if the civil servants who are busy and you want to be treated quickly, with those that have NHIF card, we have created a section there. We have slightly also created a section for VIPs.
The private will have, it is one big room, but which can accommodate 2 patients at any given time, but with the status of what? Of VIP. Then we have the fully VIP, where only 1 patient is accommodated.
We have also started an eye hospital with the support of a development partner from India. We would have started it, but because of Corona, some of the equipment, specialized equipment, could not come from India. We are hopeful that when Corona goes down, this facility will be able to equip, and it's also going to be one of the best eye hospital in this region.
The laboratory at Kakamega Referral Hospital has been equipped to a level of its kind. Being ISO 15189 certified, results drawn from it can be used across the globe.
We have also created a modern center for cancer patients, although now that one will be moved to the level 6 hospital.
The leadership of Governor Oparanya saw a gap in blood and oxygen needs not only in the county but also in the region and decided to fill it. With the blood transfusion center and the oxygen plant, the county has improved its care to both residents and those from neighboring counties.
We thought of coming up with a plant that can produce what? Enough oxygen for that facility. And we put up a plant worth 28 million that is capable of producing over 300 liters of what? Oxygen per minute.
Where we are is our medical oxygen generation plant. Basically, this is a unit that generates medical oxygen from air, which is able to be piped and delivered to point of use by our patients who are in critical state. And basically, we are looking at the critical departments, being the accident and emergency unit, the critical units in all our wards, what we call the acute patients, acutely ill patients, and then our newborn unit and the pediatrics ward, and including theaters.
We still are going to do a bigger oxygen plant for the other bigger hospitals, because the one that we have now is not enough for the level 5 and then the level 6.
Through partnerships with donors and in an effort to conserve the environment, the county government has established a waste management plant that recycles waste drawn from the county and the region.
With the support of the Belgian government through the national government, we have the waste management equipment, which you have seen, which has costed over 100 million Kenya shillings, and I saw you, if you saw it, it's also ready. It will be operational this year. Now we are already passing legislation so that all medical waste, whether in private hospital, public hospitals, health centers and dispensaries, all will come to be incinerated here.
Much of the waste was supposed to be recycled into something that is usable and less dangerous to the environment. So that's why His Excellency the Governor thought of having this facility in Kakamega. We'll be offering those services to all hospitals in this region.
In a sector marred by the current COVID-19 pandemic, unrest among health workers, underfunding and/or misappropriation of funds, Kakamega County government has strived for the better news.
When COVID came in, the facility was transformed into a COVID treatment center. So it has been running as a COVID treatment center, isolation center for the entire county until now.
We were lucky that our number here was just about 50, the maximum number, who were treated through Mumias, and they could not even fill the bed. The maximum number of people we had there were 9 at one time. And you see the hospital has over 100 beds.
And the county chief, Governor Wycliffe Oparanya, will leave no stone unturned until he fulfills his promise to the people of Kakamega County and Kenyans at large.
This is a place that devolution is working. My latest one is I want Kakamega town to be a city. I've been working towards having that as a city. Secondly, I want this town to be a medical city. And that's why we have put a lot of funds in healthcare. And you can see I have also been able to push the national government to improve the airstrip so that people who want to fly in can fly in, be treated with the specialized doctors from out, and then fly out.